Hello, welcome to this video essay on the ethics of face masks. There are a lot of questions surrounding the wearing of face masks during the currently ongoing COVID-19 coronavirus pandemic. How we frame these questions in and of themselves can contribute towards shaping the response. Consider two separate questionnaires. 1. Should we accept the death of vulnerable groups as a natural function of coronavirus? 2. Would you try to protect your vulnerable family members? 3. Are you concerned about the health risks from other people's decision not to wear masks? 4. Should the government enforce mask wearing in public spaces? 1. Do you value your personal freedom? 2. Do you think that the government should tell people what to do? 3. Are you concerned about the potential health risks from wearing masks? 4. Should the government enforce mask wearing in public spaces? As you can see, what's happened here is we've designed questionnaires in order to deliberately guide people toward one answer or another, framing mask wearing as either a public safety issue or an issue of personal freedom. One of the fundamental misconceptions regarding the wearing of masks is that their job is to protect the wearer from infection. At best, this would be a fringe benefit of mask wearing. The idea behind wearing a mask is to limit the spread of the virus, which in the vast majority of cases people carry asymptomatically from the wearer to other people. Whether or not you feel sick is irrelevant to the intended benefits of mask use. Why then is there a continued resistance from some parties to the wearing of masks? Civil liberty. Some people simply resent being told what to do, particularly by a group against which they are already ideologically opposed. Unfortunately, in the current situation, this impacts on more than one group. More conservatively minded people can view this as an attempt by the left to force them to accept societal change, and view it as another in a long line of changes which they oppose, be that acceptance of BME or LGBTQ plus rights, immigration, or welfare provision, among other things. They see this as an issue upon which they can make a stand, as, to their mind, this is a personal and not social decision. There is a similar response with those from a more libertarian viewpoint, who see this as another attempt by the state to control their lives. Ignoring more outlandish conspiracy theories for the moment, this stems from a deeply rooted mistrust of the motivations of the state with regards to the erosion of personal liberty. This broad scepticism does usually support the state taking action to protect the community. However, they oppose attempts to enshrine these in law, thus expanding people's vulnerability to police power. That expansion of legal interference or the threat of law enforcement is also going to potentially be disproportionately harmful to people who are marginalised or people who lack social power. To tackle these arguments, we should stress the non-partisan scientific evidence in favour of mask wearing. Getting this message out from a source the general public can trust is important, as is the understanding that scientific understanding evolves over time. We ought to be wary of politicians who attempt either ad hominem attacks or who seek to obfuscate the science by cherry-picking which data points to present in order to present their decisions in the best possible light. COVID-19 is not unprecedented in our lifetime, although the mortality rate is, and we should be prepared to take swift, effective action if something happens like this again. How different would things have turned out if we had gone into full lockdown 1 month in January? How might general availability and acceptance of masks slowed the spread? Again, it is important to recognise that masks are not the only element involved in preventing the spread of the virus, since airborne droplets are not the sole vector for transmission. Confusion. Some people are simply confused about what to do. I will primarily look at the UK government's response to masks here, but the same pattern has played out in more than one country. Essentially, the UK government were not able to provide a consistent narrative for the wearing of face masks. Part of the problem here was that the advice from scientists seemed to shift over time, causing fractures in people's understanding as to the correct safety measures to employ to help combat the virus spread. Articles from April, May, June and July of 2020 talk about government U-turns concerning the necessity of wearing masks in various settings. This was led by the evolving understanding of the science supporting mask wearing, as scientists theorised that the virus could be airborne. In July, President of the Royal Society, Dr. Venki Ramakrishnan, said, "I think that the evidence has shifted, and this is because we know the routes of transmission of coronavirus. We know that cloth masks and face coverings can be effective at containing the droplets that we emit when we're infected." The British do seem to be slow to uptake the wearing of masks compared to other countries. 36% puts the rate at less than half of the US, for example. This data was compiled prior to mandatory mask wearing in shops in the UK. The following timeline provides some context for the month after the pandemic was declared. Early April 2020, the WHO guidance warned that the use of masks by the public can create a false sense of security and lead to people ignoring other protective measures such as hand hygiene and physical distancing. Quote, "There is currently no evidence that wearing a mask, whether medical or other types, by healthy persons in the wider community setting, including universal community masking, can prevent them from infection with respiratory viruses." 25th of April 2020, Home Secretary Priti Patel's only mention of face masks in her statement was to observe that the previous week Border Force found £1 million worth of cocaine set to be smuggled into the United Kingdom through the Channel Tunnel, hidden in boxes of face masks. 11th of May 2020, the government said the public is advised to consider wearing face coverings in enclosed public spaces such as shops, trains and buses, but did not make the wearing of face coverings mandatory. The statement said that, after careful consideration of the latest scientific evidence, the government has confirmed face coverings can help reduce the risk of transmission in some circumstances. 4th of June 2020, face coverings would become mandatory on public transport in England from the 15th of June 2020. 5th of June 2020, face coverings become mandatory for everyone working in or visiting a hospital in England. 26th of June 2020, Scientific Advisory Group for Emergencies, SAGE, recommended encouraging the use of protective screens and face coverings to reduce the risk of transmission if 2-metre social distancing cannot be maintained. 12th of July 2020, Michael Gove, Minister for the Cabinet Office, said he did not think face masks should be mandatory in shops. 13th of July 2020, Prime Minister Boris Johnson said it was very important to wear face coverings in shops and people should be wearing them. 14th of July 2020, Health Secretary Matt Hancock said the government wanted to give people more confidence to shop safely and enhance protections for those who work in shops. 22nd of July 2020, police in London will only enforce the wearing of masks in shops as a last resort, said Metropolitan Police Commissioner Dame Cressida Dick. 24th of July 2020, wearing a face covering in shops and supermarkets in England becomes mandatory. 24th of July 2020, continued major supermarket chains Sainsbury's, Asda and Tesco announced that they will not attempt to enforce mask wearing by customers. Those who fail to comply with the new rules will face a fine of up to £100. August the 8th, 2020. Schools Minister Nick Gibb, said pupils over 11 years of age will be expected to wear masks. They will not be necessary in the classrooms as, quote, there are a whole raft of other measures we've introduced in schools to make sure we minimise the risk of transmission. As worldwide deaths topped 800,000 in late August, the World Health Organization stated that children over the age of 12 should wear face masks. 24th of August, Prime Minister Boris Johnson took personal charge of efforts to get children back to school, insisting that, quote, the risks of contracting coronavirus are very, very, very small that they'll even get it, but then the risk that they'll suffer from it badly are very, very, very small indeed. Public Health England and the Department for Education advised against the wearing of masks as they were unnecessary, since pupils and staff would be in consistent groups. 25th of August, Alok Sharma, the business secretary, told Sky News that there was, quote, no current plan to review the guidance on face coverings in England schools. 28th of August, after considerable backlash from parents, head teachers and teaching unions in England, secondary schools will have the discretion to require face coverings in communal areas where social distancing is not possible. In Scotland and Northern Ireland, masks are mandatory for secondary school pupils in corridors and communal areas. Mixed messages are inevitable during a situation like this as understanding develops. However, early and robust adoption of mask wearing could have onset some of this confusion. Either mask wearing is a significant contributor to slowing the spread of the virus, or it is not, but requiring people to wear them with one breath whilst failing to properly enforce it with the next simply muddies the message. Be clear and honest about the safety measures and explain why changes are necessary. Strength. Some people don't want to look weak. There is some evidence to suggest that men are less likely to wear face masks than women, since wearing a face covering is not cool, wearing a face covering is shameful, and wearing a face covering is a sign of weakness. Right-wing populist leaders seem to view masks as a sign of weakness. President Trump of the United States of America has criticised his political opponents for how they appear wearing a mask, and has repeatedly tried to straddle the line between saying he is all for masks and yet refusing to mandate their use from the top level. In April 2020 he said, I don't think I'm going to be doing it. Wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens, I just don't see it. His reasons for not wearing a mask in May were also questionable. I don't want to give the press the pleasure of seeing it. Therefore, he sees the idea of wearing a mask, or otherwise, to be a show of strength between himself and the pressure from, as he would put it, fake news media. Trump's right-wing voting base take this cue from their leader and also resist mask wearing, leaning on the authority and strength of the office of the president. The absence of a mask seems to have become an index of strength to this particular group. This comes from, once again, a failure or disinclination to understand the reason for wearing a mask, which is for the individual to protect the group. It might be argued that this idea veers uncomfortably towards socialist thinking, and consequently not wearing a mask becomes a symbol for the stand against left-wing politics and a fight to maintain the current status quo. This is self-contradictory, of course, since little has caused such a significant impact on the economy and jobs market and thus the capitalist view of strength of nations as the coronavirus pandemic. It is to protect those people who lack strength that makes mask wearing vitally important. Helping to protect the elderly or immune compromised who lack the physical strength to overcome infection is a show of strength about which a society can be rightly proud. Additionally, black and ethnic minority groups seem to be disproportionately affected. British Heart Foundation quote, 34% of confirmed cases of COVID-19 and 32% of deaths in intensive care are amongst people of black and ethnic minority background. According to statistics from the Intensive Care National Audit and Research Centre covering England, Wales and Northern Ireland, this compares with 14.5% of the total population who are of ethnic minority backgrounds based on ONS 2016 population estimates. Also, many people lack access to quality healthcare or are starting from a weaker position in terms of general health as a consequence of poverty. Wearing masks would show the strength of a species united against a common threat, one to which we could all be susceptible. The next great viral threat could be most deadly to white males aged 20 to 50, and then they would benefit from the strength of solidarity. One person or one group's specific strength is worth little next to the benefit of the population as a whole. Nothing looks weaker than being tied to a ventilator. Discomfort. Some people may experience unwanted side effects. Since the average person will not be wearing a graded filtering mask, and indeed you should be careful with regards to certain front-valved N95 masks, since they offer filtration from particles for the wearer but provide no barrier to droplets coming from the wearer. There is a sense among some observers that wearing a mask could provide a false sense of security and cause people to de-emphasise other important safety features such as hand washing and social distancing. Masks are only of benefit as part of a comprehensive approach in the fight against COVID-19. Masks are not comfortable to wear for long periods of time. Although this is not a design feature of the masks necessarily, the simple fact might serve to remind us that maybe we might be better off inside our houses where we can remain barefaced in our protective bubble. Unfortunately, not everyone is able to simply continue to socially distance through choice, as economic and social factors put pressure on shops and public spaces to open up, and people need to return to work. Surgical masks, often worn for their perceived protection, are not designed nor certified to protect against respiratory hazards, but they can stop droplets being spread from infectious individuals. Due to people's unfamiliarity with the most effective use of masks, some wearers are inclined to frequently readjust the mask and consequently reducing its effectiveness in the name of comfort. This can be compounded when you consider that people are only asked to wear a face covering rather than a surgical mask or something with fixed points of fastening. Other issues raised by members of the public include both religious and sexual preference concerns, where one woman complained that she was not a, quote, sadomasochist or a terrorist, and that she used to be free.
I am a healthy American. I used to be free. I am not a terrorist. I am not Antifa. I am not a sex slave that wears masks. I am not into sadomasochism and bondage.
When a different member of the public at the same meeting complained that they want to throw God's breathing system out, it is plain that there are multiple intersecting vectors of concern for people, and perhaps this is causing them to put extra weight into what we might term core values. A Republican congressman or Conservative MP declare they will never wear a mask, or that it is a monstrous imposition against myself and a number of outraged and reluctant constituents, temporary discomfort or even embarrassment should be promoted as a badge of honour. In much the same way, the people were at once shocked and impressed at the fortitude of healthcare workers who laboured for long hours in full personal protective equipment where available, and ended their days with nasty-looking pressure lines on their faces. For every person who reckons that wearing masks must surely result in their being harmed by CO2 build-up, we can highlight the surgeons who wear masks during the 10 million surgeries that take place in the UK each year. And as such, their concerns are provably unfounded. The following was drawn from the Coronavirus Deadly Masks Claims Debunked BBC Fact Check and has been edited for length. Claim: masks deprive your body of oxygen. Verdict: false claim. The breathable materials recommended for face masks worn properly won't inhibit your breathing. Breathlessness is a sign that your body is deprived of oxygen, known as hypoxia. Thin paper or cloth masks will not lead to hypoxia. Surgeons operate for hours wearing them. They don't get these problems, says Professor Keith Neal, an infectious disease expert. The World Health Organization says the prolonged use of medical masks, when properly worn, does not cause CO2 intoxication nor oxygen deficiency. While wearing a medical mask, make sure it fits properly and that it is tight enough to allow you to breathe normally. Do not reuse a disposable mask and always change it as soon as it gets damp. Claim: masks can cause carbon dioxide poisoning. Verdict: no evidence to support this claim. There have been lots of posts alerting people to something called hypercapnia, where there's too much carbon dioxide in the blood. This simply won't happen unless there is an airtight fit of your mask and you rebreathe your air, says Professor Neal. Carbon dioxide molecules are tiny, far smaller than droplets containing coronavirus, which the masks are designed to stop, and won't be trapped by a breathable material, particularly during relatively short periods like a bus journey. When you breathe out, the carbon dioxide will go through and around the type of masks most commonly worn, and is unlikely to build up to the extent that it causes health issues. We must be guided by the evidence presented by agencies we can trust. Masks help to prevent the spread of coronavirus infection. They do not eliminate it entirely, but coupled with other management methods, we can dramatically reduce infection rates and save lives. Thank you for listening to this video essay on the ethics of face masks. I have provided a considerable amount of reference links for those interested in exploring the topic further, and I would be extremely interested to hear your opinions and concerns about the subject in the comment section below. Obligatory plea for you to both like this video, share it where possible, and subscribe to the channel. Thank you.